Welcome to another video of NEET-PG 2024 recall question discussion, starting with question number 141. A statistician want to study the effect of a medicine in three groups: human groups, animal groups and plant groups. He selected some individuals randomly from these three groups: human, animal and plant. So this type of sampling is known as, yes, this is stratified random sampling. This is not simple, this is not systemic random, this is not cluster sampling. So statistician selects from three groups randomly. So this is stratified random sampling. Identify the index. So life expectancy and birth, there is means year of schooling and expected year of schooling, along with gross national income per capita. So these three together: health, education and living standards, is nothing but components of HDI, Human Developmental Index. So the answer is HDI or Human Developmental Index. It is not PQLI or HPI or Multidimensional Poverty Index. Understanding of message language or meaning of what. If there is any difficulty in understanding what the message is being given or the meaning of words by doctors, this is nothing but cultural or semantic barrier. So what option was there? It is cultural or semantic barrier. Is there any question related to Samta's diet? There is big confusion, because I am getting more confused after discussing with two shift people, morning shift, evening shift. So please let me know whether there any question related to Samta's diet. Samta's diet is nothing but your bronchial asthma, then your aspirin sensitivity. Okay, so asthma, aspirin sensitivity and your polyps. So sinusitis and polyps. So a young male, dyspnea, shortness of breath, pericardial heave, pedal edema, pansystolic murmur, right knee pain with elevated ESR, CRP and RA factor is negative. So what is the diagnosis? It is probably a case of ARF, acute rheumatic fever. Okay, coming to question number 146. I think image based question was given. So as you can see, there is villus atrophy and crypt hyperplasia. So this is typical of, yes, this is typical of celiac disease. And in the clinical scenario, I think skin rash or vesicle term was mentioned. So this may be dermatitis herpetiformis. So antibody responsible, yes, the antibody is anti-TTG or anti-tissue transglutaminase antibody. Then patient of asthma on albuterol therapy, but there is breathlessness 2 episodes per week and now night awakening 1 episode per week. The next best step, obviously you should add ICS or inhalational corticosteroid. So I think one option was there, fluticasone. So the answer will be add fluticasone propionate twice daily. Gradual loss of night visions means nyctalopia. Okay, along with also loss of peripheral vision. Maybe this was also image based question. You can see the black color speckles in the retina. So this is classical nyctalopia, peripheral loss of vision with this retinal image. It is retinitis pigmentosa. Then patient with exophthalmos tachycardia, increased respiratory rate, sweating, heat intolerance. So all these are suggestive of Graves' disease. CKD patients having tachycardia, ECG shows this. These are nothing but tall tented TOF, so suggestive of hyperkalemia. So CKD patients with tall tented TOF, tachycardia, it is hyperkalemia. Question number 151. ABG is showing decreased pH, decreased PCA2, decreased bicarbonate, and there is also increased anion gap. So this was the classical, if you calculate properly, metabolic acidosis with partial compensation with increased anion gap. So this is HAGMA, or also known as high anion gap metabolic acidosis, partial compensation. Fever, purulent sputum, BP was 100/80. Patient put on ventilation, but after few hours there is absent breath sound on the left side of the chest and increased intrathoracic pressure. This is a classical case of pneumothorax, because ventilation associated increase in intrathoracic pressure, maybe rupture of any bulla or something causing pneumothorax. There is absent breath sound in the unilateral side, so same sided pneumothorax. Pleural fluid, I think LDH was given, so more than 0.6 compared to serum LDH, and pleural fluid protein and serum protein more than ratio of 0.5. So according to Light's criteria, so the nature of the pleural fluid is exudative, and exudative is obviously TB. I think among the cause, one option was tuberculosis. So tubercular pleural effusion is because of, according to Light's criteria. 2-year-old child undergoing CPR, pulseless. This was the ECG. So what is the appropriate management? First, shock 2 joule per kg and continue CPR for 2 minutes. So shock 2 joule per kg and continue CPR. Okay, this VT patient with undergoing CPR, pulseless, 2 joule per kg shock and CPR. Next, coming to question number 155, type 1 diabetes, stage 3 beta cell destruction is characterized by, stage 3 patient will be symptomatic, there will be dysglycemic symptom, and there will be presence of antibody also. So symptomatic patient will be dysglycemic symptom along with presence of antibodies, stage 3 type 1 diabetes mellitus. 156, dyspnea pedal edema, patient of dyspnea pedal edema, diastolic heart sound was there maybe, but I think this option, this point was the most crucial point in the question, steep Y descent or also known as rapid Y descent. So this is mainly seen in, yes, you are absolutely right, this is constrictive pericarditis. So patients of right left heart failure with steep Y descent suggestive of constrictive pericarditis. Drug contraindicated is asthma. This is carboprost, not misoprostol oxytocin. I think I have repeated this question twice, sorry. Newborn with recurrent umbilical pain, subacute intestinal obstruction, surgery was performed. So there is recurrent abdominal pain and subacute intestinal obstruction, some projection was there from the ileum. This is probably Michel's diverticulum, and the question answer should be persistent vitalointestinal duct. Same type of another question might be there, child with fecal discharge per umbilicus, possible anomalies, it is persistent allantois, not urachus, because it causes urine discharge per umbilicus. 160, patients with urinary complaints, there is sterile pyuria, cystoscopy image was given. I think on cystoscopy image was golf hole ureteric orifice was there. So this is golf hole ureteric orifice, image based question was there, so I have not put the images here. So sterile pyuria, it will be golf hole ureteric orifice. In the next segment we are going to discuss question number 161 to 180. So stay tuned, in the next 15 minutes you will get another video. So subscribe the channel for more videos. Thank you very much for your attention.